Hey guys, so Reba here, who is one of our rescues, had her for almost 3 years now. She's actually an older dog. She's probably about 10 or 11, although she doesn't really look that old. But I had her and Cash, my heeler, in my truck yesterday. And when we got home, they both jumped out at the same time. And Reba landed first, and Cash landed right on top of her, right on her back. So she cried, it was sore. She actually does have a little bit of swelling and inflammation back there now from it on this left side. So I'm going to try to give Reba a little bit of relief. So I just kind of wanted to show you if this was a scenario for you at home. If you have taken some of my courses, here's some of the techniques that you would learn that you could do. Animal neuromyofascial release technique is one that you would have to be a professional to perform. But if you take our massage certification class, it actually qualifies you, or if you're already certified in a different kind of animal massager bodywork certification, it qualifies you to take this class. It's a really great technique. Veterinarians also utilize it as well as chiropractors, but it is a soft tissue technique. Kinesiology taping, another amazing technique that you're going to see how we're going to utilize this with Reba. This is something that as a pet owner you can take, and you're qualified to take it. We offer a non-certification course for pet owners and also a certification course for professionals that want to add this to their practice. This particular tape is made by Hestaband, and if you can see, there's some little perforations in it. This tape is made specifically for reducing inflammation, so it's going to work great for Reba in her acute injury. And another great thing that you can also do at home, but you can also add into your practice if you want to, is red light therapy. So we'll end the session by putting this red light pad on Reba. Let it sit on her for about 10 to 15 minutes, and this is going to help reduce inflammation, swelling, and help with the pain sensation. So again, another awesome technique that we do have a course that will teach you all about cold laser therapy as well as red light therapy. So let's get started with Reba. I am going to utilize this tool on her, and this tool just gives a really quick little impulse. It's not going to hurt her. If they're not used to it, it can be a little startling at times. I'm just going to click it a little bit to let her know what's happening. She's had this done before. And I'm just going to start up at her neck, and we're going to go down her back, looking for little areas of what we call a pathological reflex, where she has a little twitch. And as I'm getting to her lower back, she's starting to get twitchy because that's where the problematic area is. So we're going to use this tool now to try to release the fascia and the soft tissues around it. So I'm just going along either side of these longissimus muscles and giving her a little bit of quick impulses to help release that. Just help releasing any muscle spasms that are going on and letting the body realign itself. So just doing a quick little pass over with the tool. Then I'm going to utilize some of this awesome tape here, and I'm going to cut a piece big enough to go over the area where Reba's having a little bit of pain and inflammation. Go ahead and place that down on her. Going to give her one more piece just going over her back to try to give her a little bit more stability. If you're not familiar with kinesiology tape, in people, it's used commonly with athletes, and it sticks directly to the skin of the person. In animals, we're sticking it directly to their hair. And what it does is it's going to lift the hair, which will then lift the underlying skin and cause a decompressive effect. This helps stimulate mechanoreceptors, which the more those are stimulated, the less nociceptors can fire, and those nociceptors are your pain receptors. So it naturally decreases pain, but it also naturally causes a decompression, which is going to allow blood and lymph to flow better, which will cause a decrease in inflammation of that area. Now with the red light therapy, I'm going to push the button here to get that going. You can see it flashing. We don't want to shine it in her eyes. And put it directly over her back. We'll let her sit with that. That's going to help with inflammation. It's going to stimulate the mitochondria at the cellular level. She says, I'm out of here. I'll put it on her over there. Reba's never the best patient, but it's going to help with a lot of the issues that she's experiencing as far as that acute trauma. If you have any questions or you want to learn more, feel free to reach out directly to me and check out our website for more info about the courses that we offer. Good girl, Reba. That's a good girl. That's a good girl.